When it comes to butt implants, all patients are not created equal, right?
Yeah, I mean, a buttock implant is about this big and it's only going to go in one part of your butt, right? You can kind of figure out where that might be. It doesn't do anything to widen your hips. It doesn't do anything to strengthen the buttock to thigh junction. A lot of women want really thick thighs on posterior view, the strong thigh look, and butt implants don't do that. So in my practice, if I can get away with not using butt implants, I'll always go to fat. What about you, Rick?
All I can remember is one patient coming back and having something that was like a whirling dervish on her butt. You could touch it and it would go, woo!
Like a safe crack, like cracking a safe.
It would just turn and you could see it, and she was driven mad by it. So from my perspective, I couldn't agree with you more. If you can ever use fat, fat is so forgiving. Fat is yours forever.
I think that the message that patients should get and consumers should get is that butt implants don't do hip widening, thigh interface. And the second is the complication rate's about 1 out of 3 has to be removed for either infection, pain, or malrotation or malposition, as Rick said. With buttock fat grafting, the biggest pain is in the donor site of the lower back, because that's where the fat is the most resilient to be removed, and so that's where the most trauma is. So that's where the patients will have the most pain. But it doesn't come close to buttock implants.
And any residual pain that you have in the recipient site, the buttocks itself, tends to go away within 24 hours for most people.
I think the biggest issues are you can't really get a good aesthetic result because you can only cover the dome of the butt. There's a 1 in 3.
I don't know if I would agree with that. I think that in the very svelte body habitus, it can give a nice result. I've seen some beautiful results, but by and large, you're right. And we didn't even talk about capsule contractures because this is a silicone-shaped implant, right? So you get a firm contracture around that. You can't even sit comfortably, or not to mention lie on it, or have anybody touch it because it's hard and painful.
Think about having breast implants and then crawling like a baby all day on your breasts. That's what it's like putting butt implants in, right?
Yeah.
Think about it. I mean, you're putting implants in something and you're sitting on it all day. And think about how many complications we would have if we put breast implants on people, but they had no arms or legs and they just crawled, you know, like this.
I don't think it'd be as popular an operation.
It wouldn't.
Buyer beware. If you want more information, go to theplasticsurgerychannel.com.